recent viral infection and its trends in kids, which is the need of the hour. As we see in our surroundings that day to day, that there are a lot of viral infection cases and dengue and chikungunya. And again, the foot and mouth infection is also prevailing in our surrounding areas. So we felt that it is very important that it should be addressed by the doctor. So, and also wanted to give a brief introduction about our association with KIMS, that we are associated with KIMS from a longer time. And also Dr. Parag Dekate, who is the clinical director of Pediatrics and head of Pediatric Intensive Care Unit, KIMS Cuddles in Kondapur. So we wanted such a big, we have organized such a session where sir will explain you about the precautions and the causes and then the care that we are supposed to take, and also will be followed by a question and answer session towards the end. As you know that we as a school are taking that precautionary measures such as fogging it twice, and then we are disinfecting the rooms because we are seeing that foot and mouth infection also spreading across. That part is taken care by the school. And the nutrition, we are associated with KIMS, and then we have a onboard nutritionist as well who guides and suggests the nutrition on a weekly basis. So the school is taking care. School is doing a bit on that as well. So I think this session will also throw some light for the parents also to understand what is the care that we are supposed to take at this point of time. So over to you, Parag sir. And thank you so much for joining in. So you're on mute.
Yeah. Good morning, ma'am. Thanks. I would welcome all the parents here, and probably I'm also one of the parents. So I really wanted other people to understand what exactly we are going through and how we should take care of our kids. So what we are seeing currently at this moment is a lot of viral infections, and they are really troubling a lot of kids. Probably I would say adolescents also. At the same point of time, if you have elderly people, your grandparents and all, they are also getting sick because of this reason. So most of the hospitals are flooded with these viral infections. So we're going to talk a little bit about how they are presenting. Second thing is when you should consult the doctor, when it is an emergency, and common things which you can do it at home. At the same point of time, we are going to talk a little bit about prevention. So with this, I would try to share my presentation.
Yes, it's visible, sir.
Yeah. So if you see what kind of an infections currently we are seeing in the community, both in the kids and adults, these are basically, we call it as an upper respiratory tract infection, or you call it as a URTI, or some doctors call this as a common cold. So this is a common infection. Just to let you know, any child can have, a normal child can have 8 to 10 episode of upper respiratory tract infections in the year. What it means, they will have little bit initially mild grade fever. Then what will happen, there will be a little bit of running nose will get blocked, and most of the kids are basically, they're obligate nasal breather, they breathe mainly through the nose will get blocked, and because of that they will try to breathe with the open mouth. When they breathe with the open mouth, there will be little bit of a dryness in the throat. At the same point of time, the virus is kind of an irritating your throat, and then you will cough. So most of these patients or kids will have initially mild grade fever, then they will get a runny nose, then little nose block, then they will have a cough, and then by fifth or sixth day they will start improving. This is a natural history of upper respiratory tract infection, which is common all over the world. And as I told you, a child can get one episode every month to one episode every 2 months. So you don't have to worry about it. And it is nothing like that my child is getting recurrent infection, my child had a less capacity to fight with the infection, my child's immunity is low. Let me tell you, the problem which happens with the low immunity are absolutely different. There you will get a repeated pneumonias, you will get pus in the different parts of the body, you will keep on getting this infection, you need to admit. And most of the upper respiratory tract infection doesn't require admission at all, except if the baby is not accepting the feeds, they are getting dehydrated, or very, very small babies, then only will require admissions. Then we are seeing some pneumonias, And in a different words, from the doctor perspective or medicine perspective, we call it in a there is a different nomenclature. So we call it a pneumonia when the part of the lung is involved. We call it a bronchiolitis when it's a smaller child and they have a breathing issues. We call it a valvular. So they are actually a spectrum of a same disease, but different nomenclature. Then we are seeing a lot of dengue fever. So we'll talk about it. This time it is good that the dengues are not causing much of a trouble. Then there is another thing which came, which was initially there, was not there in between for some time. And again came chikungunya fear. And we are seeing some undiagnosed viral infection. I will talk about it because last 1 week I could see there is a lot of uh, talk happening over the newspaper about this undiagnosed viral infection. And this definitely there is some recent care of monkeypox. We'll touch base upon that. And just ma'am has added hand foot mouth disease. I'm seeing a little spurt of hand foot mouth disease. I will talk about it also. So most of the upper respiratory tract infection, as I told you, they will present with some kind of a nasal block, mild grade fever, cough, sneezing. Sometimes lot of parent comes to us or they consider as a chest congestion. Remember, so what is chest congestion is? It's a very vague term. Chest congestion means sometimes child can have some noisy breathing, but they're breathing fine, they're active, they're playing around. That is not a chest congestion. That is basically there are some sound coming out of the throat. This is not called as a chest congestion. When we call it a chest congestion, when they are actually not able to their daily lifestyle activities. If they walk around or play around, they're breathing faster. Or if you see or actually undress them, they will see the breathing is really little bit faster. They are breathing faster and they're breathing like this. They are making this sound. Then the chest congestion is significant. But if they are active and they're occasionally, sometimes in the day, they are having some kind of a noisy breathing, it is not chest congestion. Definitely because of the virus, they feel a lot of fatigue. I told you most of the viral infection, remember, if you have a sudden onset high fever, like in the morning, child was fine, and by afternoon, you have a 102, 103 fever, invariably, maximum time it's a viral infection. Usually, bacterial infection will build slowly, fever will start going up. And in the viral infection, in between the fever, child will be active, they will be participating a lot of activities and all those things. And once the fever comes, they become dull. So most of the sudden onset fevers are viral infections. Some bigger kids can complain about sore throat. I am seeing a lot of viral infections are coming with sore throat, but their throat are fine. They are not congested. It's not red, but they're having a little bit of a throat pain. This is mainly because of the irritation of a virus into the throat. When it goes down into the lower part, so when you have a nose, you have a nasopharynx, mouth, throat, and trachea, it goes below that, then we got a lower respiratory tract infection. I have a diagram for that. Then you sometimes get the shortness of a breath, and coughing is invariable part of that. And we'll talk about cough and cold preparations also. So what are the common symptoms? As I told you, they will have a fever, cold, nose block, sneezing, sometimes noisy breathing. Remember, noisy breathing is because of the nose block. So most of the kids, specifically less than 1 year of age, they are obligate nasal breather. What do you mean by obligate nasal breather? Means they will breathe through nose. Very unlikely they have a capability to breathe through the mouth. So what happens is, just imagine the nose. Like this is the dimension of a nose, and this is the way actually air is going, and you're breathing through that. So if you have some secretion into that, the size of this cavity or size of this circle or nose cavity is reduced. And as per the physics, the resistance, if your nose is blocked by, let it be X, your resistor increases to the power 4, X to the power 4. So that you can imagine how uncomfortable for the kids, specifically smaller kids, to breathe with some secretion into the nose. So remember, nose block is also prominent, and how to treat it, we'll talk about it. Small kids, they will have difficulty in feeding because most of the kids, you remember, we can either breathe or swallow. We cannot do two things together. So what happens is, when they are drinking or eating, they have to stop because they cannot able to breathe through the nose. They have to stop. They will stop feeding. They will breathe through the mouth, and then again they will start eating. So this is the way most of the kids will have a difficulty in feeding, specifically smaller kids less than 1 year. Only 85% of the time they will have this cough, cold, a little bit of nose block, and all those things. 15% of the kids can have a breathing issues. That means the upper respiratory tract infection can go a little bit down and they can start having breathing issues, where they will have a rapid breathing, they will breathe faster, Usually a normal kid breathe around 20 to 30. So they will start breathing more than that. But remember, sometimes these kids can have fever, and during fever, your breathing count increases. So even if there is no fever and the breathing count is more, that means the child is having a breathing issues. They become irritable because nose is blocked, so it's congested. They are not able to breathe, they are not able to feed, they are dehydrated, so they become irritable. Sometimes can be associated with watery eyes or eye congestion. So upper respiratory tract infection can involve the eyes also, sore throat, as we discussed, some pain in the throat, and sometimes some viral infection can present with rash. Almost every time, if you have a cough cold with the rash, it is unless and otherwise proved it's viral. Why I'm using the terminology viral and viral, we'll talk about it because the treatment depends and differ. What are the uncommon symptoms? Breathing issues. Why you should keep in mind uncommon? Because this is a time where you have to think that something is wrong. So breathing issues, that means they are breathing harder, faster, or they are not able to catch their breath. They are excessively sleepy. They are not eating. They are getting dehydrated. So initially, a child used to pass 7 to 8 times urine in a day. Now he's passing 3 to 4, or not passing urine for 8 to 12 hours. And sometimes it can be associated with feeding difficulties. It can be associated with loose motion, vomiting. And remember, keep on watching fingers and all. Sometimes their oxygen level goes down. In that, if you see the nail beds, lips, they will become a little bit blue. That means something is wrong, oxygen is going down, and they are drowsy, or they throw some fits, or they are not looking comfortable, or they're having excessive ear pain because the ears are connected to the throat. So if they're having excessive ear pain, that are uncommon symptoms, and you should make sure that you visit your pediatrician immediately when you are having these symptoms. So now, as I told you, when to see a doctor and when to visit into the emergency. So if you have a fever which is lasting than 48 hours, child is doing fine, okay, having a cough and cold, little bit of nose block, you can take care of him at home, her or him at home. What to take care, I'll talk about it. So, but if the fever is persisting, high spiking, more than 48 hours, there are breathing issues, child is breathing rapidly, or intermittent breathing issues are there, not able to feed, there is a dehydration, cough and cold disturbing sleep. If cough and cold is not disturbing sleep and feeding, you don't have to worry, you don't have to start medicines. No need of a cough and cold preparations at all. So cough and cold which is disturbing sleep or feeding or normal day life activities, then you should visit your doctor and seek a help. I am seeing a lot of kids who are having this viral infection. They have a lot of body pain. So, specifically, flu, influenza, it has a lot of body pain. It can cause injury to the muscle also. They are not able to walk. Smaller babies less than 6 months of age, probably less than 1 year of age, who are not feeding well, looking little bit bad, you should go and see a doctor. Ear pain, as I told you, or any child who had a underlying disease. There are a lot of kids who had a different allergies, asthma, diabetes, or any heart condition, previous surgeries. They should go and see a doctor at the end of 42 hours or before that if any of the danger signs are there. When you feel very uncomfortable that my child is not looking well, we should go and visit into the emergency, even if it is a 2 o'clock, 3 o'clock. Very rapid breathing. That child is drowsy and not waking up, persistent vomiting or loose motion, diarrhea, getting dehydrated, throw a fits or a seizure. Child is persistently irritable. What happens a lot of time, this respiratory infections, you are not able to breathe. So you are not able to breathe, the oxygen levels goes down. And because of that, the oxygen levels in the brain also goes down and you feel uncomfortable and irritable. And in that situation, probably things are going out of the context and we should go and visit a doctor. Fingers turning blue, so basically, dusky fingers, nail beds, lips, that means the oxygen levels are going down. And a lot of these kids are having headaches. Sometimes some infections, viral infection can cause infection of the brain also because of meningoencephalitis. So you have a persistent headache. The previously child was absolutely fine and suddenly with the viral infection, child started having headache. All those things are really bad and we should visit in the emergency immediately. Lot of kids have a mild headache with fever, which doesn't need you have to come to the emergency, but if it is persistently there without any fever, that means something is wrong and you should go and visit emergency. So as I told you, 85% of the cough and cold viral infection, upper respiratory tract infections can be treated at home, doesn't require any intervention or supervision. So what is important is hydration. So whenever I talk about hydration, hydration doesn't mean only water. Whenever I ask parents, is it hydrated? He's drinking water. No. Water is also important, but salt and sugar is very important. So, what are the different forms of hydration? ORS is the best. Remember, there are a lot of ORS available in the market, specifically not the Tetra packs. Even if you are buying a Tetra packs, make it sure that they are WHO recommended Tetra packs. They are WHO recommended Tetra packs. Or you can buy a small sachet and make it at home. This is really important because most of the juices or ORS juices available in the market has a lot of sugar, which is not good, less sodium, it causes a lot of trouble. Or you can make a salt sugar solution at home. You can give probably a coconut water with little bit of salt, buttermilk. So any kind of a liquids where there is a salt and sugar, it's good for the body because it will give you electrolytes as well as glucose. Frequent feed. So if the, because what happens in the cough and cold, lot of times child keep on coughing. With the cough, what happens? There is a propensity that they will vomit because they're using this chest muscle, abdominal muscles very vigorously, and the junction between the food pipe and stomach is not that strong for the kids, so they can throw up. So probably you might have seen when you cough vigorously, there is a chance that something comes out of your mouth, but you have a capacity to control it, which is not possible in the kids. So what happens? They threw up. This is called as a post-tussive vomiting, and I have seen a lot of parents or other what you called caregivers try to give vomiting medication in these patients. It is not going to help. Vomiting medication will not help in a post-tussive vomiting because this is mainly because of the mechanical reason. So in that situation, what you give? You give a small feeds. Don't stuff the tummy too much. So small feeds, small diet throughout the day. That is better. You can use saline water drops. Again, saline water drops are mainly plain saline drops. Why? How it acts? You give it through the nose. What it does? It will thin the secretions in the nose. And because of what will happen? These thin secretions will go down into the throat, and probably kids will swallow it, which is absolutely fine. A lot of parents tells me the child vomited today. There is a lot of phlegm comes. This is okay. 5, 6, 7, 8 years, child is not going to throw the phlegm. They are going to swallow it, which will go into the stomach intestine, which is absolutely fine. So keep on using nasoclear to keep the nose clean. Steam inhalation, I'm a very strong follower of steam inhalation and warm saline gargles. Steam, you don't have to put Vicks or Carbol Plus, or if you wanted to put, you can put it. Make it sure there are no accidents. What I recommend to most of the parents is uh, make the child comfortable, keep it in your lap, keep a steamer beside you, put a bedsheet over you. So you have to take a steam with him or her so that you should know what is the kind of a temperature and what you are dealing inside. Bed rest, they have a lot of myalgia, though they tolerate this all better than us. So make it sure that they have a good bed rest. Paracetamol and ibuprofen, let me tell you, I've been practicing for fever medications, paracetamol, ibuprofen since last 20-25 years. No use of Meftal. Please stop using these Meftal medications. It is almost like a banned medication, and the DJC has approved a lot of alarms about this Meftal medication. So only two medication you are going to use, paracetamol and ibuprofen, ibugesic. The first and the foremost and the safe choice is paracetamol, which can be given appropriate doses every 4 to 6 hourly. And make it sure that till the child is not having fever for 2 days, child is looking fine, no breathing issues, then only send the child to the school. Because why I'm telling this is, it is a vicious cycle. What happens is, not every child is going to have the same virus. So let it be a X child had a some flu virus, he recovered. He recovered, but now there is another child who is having a cough and cold. So what will happen is, the moment he recovers, he has a less power to fight with the infection, or he's just recovering, his body is recovering. There is a high chances that he might caught the infection. So he come across another child who's having cough, cold and fever and catch another virus. I keep on seeing kids coming every weekly to me, fever, cough, cold, fever, cough, cold. This is mainly because of the infection or a cross infection. So it is our social responsibility that our kids are having fever, cough, and cold. Kindly notify and make it sure that at least for 24 hours there is no fever, cough, and cold is improving. Then only send, and with the precaution with the mask. Now, commonly misused medications, what we see in cough and cold, is cough and cold preparations. Let me tell you, cough and cold preparations are absolutely useless medications. Okay, so cough and cold preparation, if you can you mute this? Sorry.
Vihan, can you please mute?
Yeah. So this cough and cold preparations are almost useless medication. I could see there are a lot of parents comes to my OPD and ask about this cough and cold preparations. So in this kind of situation, if you go back and if you have any of your family members in Europe or North America, ask them, do you get cough and cold preparations? They will say no. So the reason is the FDA doesn't approve to use any cough and cold preparation less than 4 years of age. No cough and cold preparations. Okay. So I also stopped using this medication, but in a desperate situation when cough and cold is compromising your sleep and feed, you can try and see this medication if it is helping. But most of these medications are useless medications. So unless and otherwise you're hitting the wall, it doesn't make sense in using. Now I see a lot of nebulization because last time doctor has given some nebulization, we keep on using, and it is over the counter Livolin, Budicort, keep on using it. Let me tell you, Livolin and Budicort are asthma medication. They are not cough and cold medication. There is a specific indication to use this medication. Sometimes you can use plain saline nebulization for humidification, but remember, warm humidity is better than the cold. So normal saline nebulization is basically a cold humidity, but if your child is not taking steam inhalation, you can think about using a plain saline nebulization just to humidify things. Antibiotics, we don't want it to wait. Fever doesn't mean deficiency of antibiotics, okay? So don't start antibiotics just like that. There is no role of antibiotics. 80% of the infections are viral. So there is a specific indication for using antibiotics specifically after day 2 or day 3. I have seen we keep on using a lot of Vicks vapor rubs, Zinda Tilismat. I had a child who had thrown a fits because the mother father has put a Zinda Tilismat in the water and gave it, and the child had a seizures because of that. So please don't do that. Vicks vapor rubs, they are all comforting medications. It will give you a sense that it is opened up. So you can use it in a mild doses, not a moderate doses also. Allergy medication, commonly we start cetirizine, we commonly start Allegra, which is absolutely not unless and otherwise you have a background history of allergy. Puffs and nasal spray, in and out. One of the medication we keep on using it, Monteralcicid. Any child who's having cough and cold will start for 7-10 days. No, please stop using this medication. It causes a lot of psychological disturbances in the kids, specifically Montelukast. And it is not a medication for cough and cold. It is a specifically medication designed to help the asthma patients. This is not Striven nasal drop, it Otriven nasal drops. Again, commonly available, child is not able to breathe. Again, this nasal drop has a medication which can increase the blood pressure in the kids. So in a very specific scenario, we use that when it's absolutely the child's nose is completely blocked and they need help, and we are using all those things. We are using saline drops, steam, still it is not helpful. Then sometimes we ask them to use it for a couple of days and then stop it. So remember all those things very importantly. So what are the important points at the end? So almost 80 to 90% are viral. Why I'm saying viral is I am doing a viral PCR of almost every kid who has actually qualifying for more than 2 to 3 days. We take some small secretion from the nose the way we used to do a COVID test, and the reports currently these investigations are cheaper, not that costly, and you will come to know. And let it be, what is an importance of that is because of this, once we know viral, we are comfortable. This is a viral. There is no treatment available. We have to wait and watch. Give hydration, humidification. No unnecessary use of antibiotics. Whole world is facing a problem of over-the-counter antibiotics. Kerala is the first government who stopped giving over-the-counter antibiotics. So use of antibiotics. Then follow social distancing and mask. I want really strongly to follow this. And we have already learned our lesson in the COVID. During the COVID, kids never had a cough and cold. Actually, because of the mask, you will not believe 20 to 30% of reduction in the chances of tuberculosis in India. It is a collateral kind of an advantage we had with using mask. So use plain simple mask, 1 layer, 2 layer mask is also helpful. Okay. And during this time where we really wanted to keep our kids safe. So because 15% chance that they will land up into the hospital. They are almost self-limiting, 85% by 1 week, they will go away. No need of antibiotics or blood test in almost 80% of the infections. Cough and cold preparations are not magic medications. You know, whatever the study says, there is a cough and commonly used cough medications called as a dextromethorphan. Dextromethorphan and honey are equally efficacious. This is actually a real study. Honey and dextromethorphan are equally efficacious, and honey has a less complication than dextromethorphan. So you can keep on using honey. Cold remedies, sometimes you give warm water, 2 times brush. While sleeping, keep them a little bit propped up, or if they wanted to sleep on the one side or tummy down, these are all good things because the secretions will come out and they will not have that trouble. So 15% can become a little bit sick, and I told you what are the dangers and keep watching them. Hydration and humidification is very, very important. So if you remember, a lot of parents ask me, can we use air condition? Can we use all those things? So I wanted to tell you how air conditions is kind of a problematic in cough cold. It's not like that you cannot use it. So in a summer, we have a dry and hot air. So what will happen if you keep on breathing? So nose secretions become thick, and it is not possible for the kids to clear those secretions, and that's why they get a noisy breathing and irritation in the nose. Specifically, when we use air condition, we know that it's a cold and dry air, so relative humidity goes down, and that's why they get a dryness of the nasal secretions. So this is the way. So if there is a pleasant weather, you can switch off the AC. And another thing from allergic point of view, keep on cleaning the air conditioner. And probably you might be knowing, or I wanted to tell you, this is a very strict instruction to the all TS2 and TSRS school to clean the AC ducts frequently, because we don't want that to happen, and they are following that since the COVID time. So this is really important. And remember, hydration and humidification. Whatever the kids get admitted into the hospital, they are getting admitted just because of the hydration, because they are not able to hydrate. So keep on hydrating them. That is the most important thing if you can do it for your child. Then when to consider bacterial? When we said, okay, no, there is enough. Actually, I don't feel it's a viral. So as I told you, viral, sudden onset high fever is viral most of the time. In between the fever, child will be good. There will be an involvement of the other family member. There will be history of a travel. You went somewhere, and some of the kid was sick, or they came across, they went to the daycare where the kids are getting sick. And usually they are in between good. They will think, eat, their oral intake will come down by 30-40%. They will start eating and they will be fine. So this is mainly viral. Bacterial are slowly worsening. Day by day, child will keep on getting worsen and worsen. Fever will increase over days. In between the fever, child will not improve. They will be dull, apathetic. They will not, they're sick looking. They will be toxic. They're irritable. And you will see only one child is involved in the family. Other kids are fine. So these are you should consider these are bacterial infections rather than the viral. So in pneumonia, when we think that upper respiratory tract infection is done, when what is happening to the lung? So what happens when you have a high fever, more cough, the secretions, the color of the secretions coming from the sputum is yellow, greenish, change in the color of a sputum, more breathing issues, they are more frequently. Child is looking toxic, irritable. And sometimes there is a dusky nail beds, or a lot of parents have a oxygen monitor at home. It is showing less than 94. Any saturation in the room air less than 94, go and visit your pediatrician. Okay. And gradually worsening. Sometimes they get a chest pain. I see a couple of patients in the last couple of months, they are not walking. They're walking just like that, bending forward. And most of them had a pneumonia. So these are all subtle features where you can identify pneumonia early. As you see, this constitute upper respiratory tract, which includes nose, sinuses, mouth, pharynx, and larynx, and lower respiratory tract infection. Mainly, we are worried about this part. There is another condition which I have not mentioned. It's also croup. What happens is child will have a barky cough. The cough sound will be like that. And second thing is when they breathe, they will breathe like that. This will go inside. That is also very dangerous. You should visit emergency immediately, because treatment is completely different. That we call as a croup. So if you have this which is growing inside, or you are breathing like this, or coughing like that sound, so that means it's wrong, and you should visit the doctor immediately. What happens in the croup, this is a breathing pipe. So breathing pipe, there will be some swelling, and the breathing pipe becomes smaller. So if it becomes smaller, it is very difficult to breathe through that. So this is called as a croup. So usually pneumonia can be diagnosed by symptoms and clinical examination by the doctor. Sometimes we do a chest x-ray to know where is the pneumonia, upper part, lower part. Not all pneumonia needs admission. If they are having a low oxygen saturation, they are not eating well, then only they need admission, or they are breathing very fast. Otherwise, it can be treated on the OPD basis. Usual treatment is oxygen and antibiotics, and they improve. Some of the viruses can also cause pneumonia. Actually, if you ask me, most common cause of a pneumonia is still virus rather than bacteria. And there are small different nomenclature we use. Some we use V's associated lower respiratory tract infection, bronchiolitis, and all those things. But the treatment remains the same. So what are the treatment as we discussed? So again, flu vaccination. I have spoken with a lot of parents. There are mixed thoughts, but let me tell you, if you give flu vaccination every yearly to your child, don't expect that it is going to prevent your child upper respiratory tract infection. Your child will still have cough, cold, fever, You will have that routine every monthly, 2 monthly cough cold. What flu vaccine is going to do is it's going to prevent you major flu. Major flu means flu pneumonias, flu brain infections, and sometimes flu can be very, very bad. So that will be definitely taken care of if you give flu vaccination. So I would recommend strongly flu vaccination this year, because last year also there were too many flu patients, and this year also almost 20 to 25% are flu. Definitely, this is a request to, actually, I'm also parents, so all of them, that if the kids are sick, please take a time and take care of them at home and keep them at home. The reason is, I told you, a vicious cycle of cross infection. Your child will come off, your child will go to the hospital. There is some child who is mounting a viral infection, get exposed, again, your child will get an infection. This vicious cycle keep on happening. And if you have elders at home, again, it is in trouble. I wanted to take this opportunity because I think so. We have almost 70, 80 people. They remember, if you have elder or grandparents at home, their vaccination is also available. It's absolutely equally important. We have learned our lesson in the COVID. What has happened is kids got a COVID, grandparent came to take care of them. And what had happened? Grandparents got a COVID and they had an outcome, very bad outcome. So they are also very important part to keep this infection into the vicinity. They might not get sick, but they might harbor the infections. Again, they might give it to the other people. Sometimes for smaller kids, when I tell them ki, madam, this child is having viral infection, did you went to any of gatherings or any travel and all? They said, no, no, we are at home. Child never got anywhere, doesn't go to the daycare. How this child got a viral infection? Then I told, we are only responsible for that, because we go outside, speak with 10,000 people, get a virus in our nose, but we are not having infection. The reason is probably we had an infection before and we are protected, but this virus is causing trouble to your child. So this is called as a reverse isolation. So make it sure that you take care of yourself. If you have a smaller child less than 2 years of age at home, take care of yourself so that your child doesn't get sick. Hand hygiene, very important, frequent hand washing. Okay. My kids hate me because I keep on asking them to frequently hand wash. Assess your own risk. Use a mask whenever it is required. It is really, really simple measure, 50% drop in an infection. Ventilation, very important. So most of these things are taken care as in ventilation, check, cleaning the AC ducts, cleaning the AC filters is all important. Definitely at this mode, if you ask me, I will strongly recommend masks. Avoid the close contact. Do not touch the. So I could see there are a lot of patient comes to my OPD. They keep on coughing. So we have to tell our kids what is a cough hygiene. So don't use hands. The reason, if you use hand, it comes on your hand and it will spread. You can use your kind of a upper part of the hand or use an handkerchief. Frequent cleaning, mask, hydration, wash your hands and take your, I would say, sick leave. Sorry. Now, going to the dengue fever. Again, it's kind of a diamond in the crown when we are talking about this kind of a scenario. So we know that dengue, again, is a self-limiting viral infection. Again, it is a self-limiting viral infection. I wanted to tell you that there are so many people who get a dengue. There are a lot of kids or adults who get a fever for a couple of days. They are not having cough and cold. Probably they might have a dengue, but it's a self-limiting. It improves. So around 50, 60% of the time, you will not come to know that you got a dengue. The reason is probably your hydration is good, your body is good. So you got a fever for a couple of days, you're eating well, drinking well, and it got self-limited. It improves by itself. So it is because of the anopheline mosquito bites. Again, it goes spread not from the person to person, but from the bite of a mosquito. Usually symptoms, we'll talk about it. They will have high spiking, sudden onset, high spiking fever. They will get it. They will get a bony pain. They might get some joint pain, muscle pain. They get a tummy pain. A lot of kids have a tummy pain. Why it gets tummy pain, I will talk about it. Vomiting, they will not eat and drink, some redness of the eyes, retroorbital pain, eye pain, headache, these are all common. And they will start getting some rash. It's a diffuse reddish kind of a rash all over the body. These are the common symptoms of dengue. Remember, dengue has a two phase. One is febrile phase. That means you will keep on having fever. When you have a fever, you are relatively okay. You will not have major trouble. Most of the kids or adults will not have major trouble. Major trouble starts when the fever goes away. We call it an febrile phase. What happens, I will talk about it. But these are the basic symptoms: headache, fever, Sometimes they can get a small spot, bleeding spots. So how to differentiate between rash and a bleeding spot, I will tell you. If it is a rash, if you press on the rash, what will happen? You will see that rash will become, it's like a blanch. So the redness will go away. But if it is a skin bleed, if you press on that, it will not go. Because it's kind of a mechanical structure. There's a bleed inside the skin, it will not go. That is called as a pitachi. So remember that lot of kids can have a small bleeding from the nose or mouth, which is again a bad sign. So keep on. But the biggest trouble in dengue is basically a low blood pressure. And why it happens, we'll talk about it. So as I told you, febrile phase, you have a high fever, which is most of the time sudden onset. Shivering and rigors might be there. Another thing, a lot of parents ask me about, is it shivering and rigors? The child had a fever. So remember, when you get a shivering and rigors are protective mechanism of the body to release the heat. So once your temperature goes from low to high in a short span of a time, your body try to release a lot of heat through the contraction of a small muscle, which is actually in and around your hair. So that's why that is not like a something wrong. If your temperature goes from slow to high in a short span of a time, you might have seen a lot of kids have a 105 fever, but they don't get shivering and rigors. But sometimes you might have seen the child had a just 101 fever, still get a shivering because the rapidity it has increased. You can have a rash all over the body, might be there for 3 to 4 days. Fever might be there for 3 to 4 days. Headache, eye pain, abdominal pain. So now why they get abdominal pain is, so you can see a lot of blood vessels. You can see your own blood vessels also in dengue, normal patients. So what happens in a dengue na? There will be just imagine there will be a small hole in these blood vessels. So if there is a hole in the blood vessel, what happens? When the blood is flowing, the water from the blood will come out. It will get deposited in and around the blood vessels. So if the water comes out, what will happen? You will have an internal dehydration. So because of that, your blood will become more thicker. If your blood is more thicker, it will flow slowly. And because of that, they will get abdominal pain, low blood pressure. And if you do a blood investigation in these kids, you will see their hemoglobin is 14, 15, and you will feel very happy. Oh, my child hemoglobin is good, but that is actually bad. Because average hemoglobin for Indian kids will be around 12. So if you see any child who's having hemoglobin of 15, or you have a previous report, his hemoglobin was 12, don't be happy if they have a fever. There is something wrong going on. They are getting internally dehydrated. So remember this. Another byproduct of dengue is low platelet count. There is nobody can do anything to the platelet count. It's a part and parcel of a dengue. What happens is during the fever, their platelet count will be fine. Once the fever goes away, this blood thickness increases. Your platelet goes down. They will stay there for some time and it will increase. The chances of bleeding in a child with the dengue with the low platelet count is only 1%. Life-threatening bleed, that means into the brain, lungs, liver, and all those things. So don't worry about that. The need of platelet is also very low. So you don't have to give platelets and all those things in these kids. So these are the mainly two things we have to monitor. And the most important thing, treatment for dengue is hydration, paracetamol. There is no antibiotic, no platelet, nothing, no papaya leaves and all. If you wanted to give, you have a belief in papaya and papaya leaves, you give it. But that is not the treatment for platelet. Otherwise, all the hospital will have a papaya tree by this season. Or the person who has devised it, he will get a Nobel Prize. What happens in a febrile phase? The fever goes away, cold peripheries, your peripheries become cold, mottled, the color changes. You can have a skin bleeds, rash increases. They will be more apathetic, poor feeding, lethargy. Sometimes blood pressure will be low platelet count. And if you 2-3 days, they remain okay, they will start improving. Sometimes they will have a decreased urine output at different bleeding spots. So this is a very bad phase. And if you see that, you should visit a doctor immediately. So this is an febrile phase of dengue. When to see doctors? Again, almost same. You have a fever lasting for 48 hours, worsening rash, body pain, they are not able to walk. Small babies, any dengue less than 1 year of age is very bad. Like it can be really bad. So visit. Or a child who had a dengue couple of months back, again, there is a dengue. You should be very cautious. Okay. They can be really sick. Bleeding from any parts, or you have a chronic illnesses and all those things, you should visit a doctor immediately. Emergency visit, the algorithms remains the same. They are not eating, dehydrated, loose motions, headache, bleeding from any side, rapid breathing, you should go and see the emergency immediately. So not all dengue needs admission. Hydration is the most important thing, because the treatment, if they get admitted, I'm going to put an IV line and start hydration. Watch for the bleeding spots. Blood test, don't try to do any blood test for the first 2 days because it is going to come normal. Because there is some test called as NS1 antigen, it comes positive at day 3. So no need of a blood test for the first, second to third days. Watch for the bleeding spots. Most of them don't need platelets. No medication to improve the platelets, please. Most admission for monitoring of a blood thickness and platelets. Okay, so hydration is really important. There are so many kids, they have a platelet count of 50,000, but they are drinking like a champion. We don't admit them. So how to prevent it? Everybody knows it, but make it sure that there is no stagnated water in and around you. So we have to take care of the mosquito. We have to take care of the mosquitoes. So how are you going to take care of the mosquito? You try everything. No stagnated water in and around. Probably use mosquito repellents. Okay, mosquito repellent on the. There are small roll-ons and all those things available. How many efficacious are there? We don't know. Aerosols you can use it. Close that room for some time so that it washes away all the things are going on. And if it is still problems are there, make it sure that you are using a nets and a full clothes is very important. Full clothes are really important when we are talking about dengue scenario. Now, chikungunya, again, chikungunya is almost again a self-limiting viral infection. No treatment is available, nothing. The only difference with the dengue is they have a really a bad joint pain or muscle pain. And they can have a nausea and all those things, but mainly thing is a joint pain will be a very, very prominent things. And it can be really bad that you have to use few medications to take care of that pain. So few of the aberrations what I'm seeing in chikungunya is again this chikungunya present with some fever, headache, chills. You will have a back pain. More, I'm seeing kids they are not able to walk. They are having so much of pain. But if you ask them to be on the bed, they are moving their legs, but they are not able to bear the weight. So it is really a painful situation. They will can have when you think that the things are going out of the way. That persistent fever, joint pain. We are seeing a kids actually who is having a pain for 2 weeks also. So you make it sure that you have an appropriate consultation to use a good painkiller. Sometimes, very rarely, they are using a low dose of a steroid also because otherwise they keep on getting pain. We have to reduce the inflammation in the joint. They are requiring a lot of painkillers. Continue normal mobilization. Don't stop completely. Let them move a little bit because otherwise they will get a more pain. Hydration. Avoid excess use of NSAIDs. Don't use it. If it is pain going above 5 or 6 out of 10, then definitely think about. And you can have a warm and cold fermentation of the joint to help them out. Now, monkeypox, we don't have to be really kind of worried about this, but you can see the incubation period is around 3 weeks. You can have rash around 1 to 4 days after that. It looks like a chickenpox kind of a rash, dewdrop type of thing. You can have fever, headache, muscle pain, swollen lymph nodes. It's quite common. What do you mean by swollen lymph nodes? Is if you have an infection everywhere, the lymph nodes will try to kill that infection and they will swollen up to protect you. Chills, exhaustion, respiratory symptoms you can have sometimes, and pimples, blisters kind of a thing, like a chicken pox, but more painful, more sore. Again, direct contact is a source of kind of a spread. So body fluids, like the fluids from the small rash or mouth fluids or anything, those who had a monkeypox might kind of transfer this infection. Fomites, so like somebody had his secretions on one part of the table and you touch it and then again it went into your nose, you can have that infection. So at this moment, they have raised a concern. So whenever probably we see, again, we go back to the basics. What are the basics? Frequent hand wash, using mask, using sanitizer. These are the mainly 3 rings which is going to help us to take care of this monkeypox. I would not go, but you can see symptoms are rash, swollen lymph nodes, headache, muscle, and we have high alert in India. Sorry, in and around, specifically in Africa. So at this moment, though we are actually not getting these cases in India, we have to make it sure that probably we are not the one when it comes into the India we are percolating this. So skin to skin contact, face to face, mouth to skin, mouth to mouth, all those things can give rise to transmission of this infection. Now, I have not completed this hand, foot, mouth disease because madam just took about it. So, hand, foot, mouth disease is also a self-limiting viral infection caused by a virus called as a Coxsackie virus. It has a different symptoms. I have seen a lot of kids treated as a chickenpox also outside, but it is not a chickenpox. They will get a rash, specifically on the. They will have in elbows, hand, feet. Classically, you will see the sole, palm, and sole involvement. They will get a rash over it. most of this rash is not itchy, it is painful. Another thing, in and around mouth and mouth ulcers. So it's a variable. Sometimes around the perianal area, in the butts, also you can get some rash. So most of this rash is painful. So you can use judiciously paracetamol and ibugesic to take care of the pain, because they can have a throat ulcer also. Take care of the pain. Once the pain is down, use fluids. So in hand, foot, mouth disease, cold and warm fluid will be helpful. A lot of times we'll say we should not give cold when there is a throat infection and all. But in hand, foot, mouth disease, cold things will be helpful. Specifically those jellos, cold jellos, which has a good amount of hydration, you can use them, because most of these kids need admission because of the hydration. Hydration is the most important thing, and pain control. Usually this rash is not itchy. To soothe the rash, there are you can use a good moisturizer cream, and on top of that you can apply some lactocalamine so that the rash is not causing irritation. Most of the kids are self-limiting. It can come from one child to another child. So whenever you notice, please don't send the kids unless and otherwise rash completely scabbed off. Till that time, they can still percolate the infection. And there is another fever, probably 5, 6 months back, we were talking about it, tomato fever. Again, that is also a similar brother and sister of hand, foot, mouth disease. They started calling it tomato fever, but hand, foot, mouth disease, involvement of the palm, soles, leg, and things, and mouth and ulcers and in and around mouth. Now, in the last week or 10 days, there are some articles in the paper about some undiagnosed viral fever. Sorry, there are some undiagnosed viral fever. So what is this undiagnosed viral fever? Let me tell you, this year though kids are having flu, dengue, but they are relatively better as compared to the last year. They are not having major issues this time. They are relatively okay. Their platelets are not dropping. They're hydrating, so they are not requiring more of a trouble. Probably parents are doing a good job with the hydration. So what this undiagnosed viral fever is, it is behaving like a dengue. That means they have a fever, body pain, and all those things, and we are doing test at the 2, 3 days and 4, 5 days. It is still coming negative. Chikungunya is also negative, and they are having a high grade fever lasting for 4 to 7 days. But they are relatively okay. Little bit goes down. Their oral intake goes down by 30, 40%, and they are improving. They have a little bit of drop in the platelet count and WBC count, but not much. It drops and then it recovers in the next 2, 3 days. And the treatment here is again hydration, paracetamol, and ibugesic, and frequent feeds, so that they are not becoming dehydrated. So whatever our duties, okay, what I would say is kindly break the chain of this transfer of infection. So at least 2 days there is no fever, then only send them to the school, ask them to use mask, promote mask. I would ask a lot of other people as well as from the schools to promote the mask till we tide over this situation for the next couple of months. Hand hygiene, vaccination, yes. If you have not vaccinated your child for flu, it's a good time to vaccinate them to prevent the major flu. It is not going to reduce the chances of normal cough and cold. Mosquito control is really important. Be vigilant about the bad signs of a dengue, as I told about it. Remember COVID, we all did all those things to prevent ourselves and our family members. And at that point of time, the chances of all those allergies, everything went down. So probably bring some small changes in that. Even if we do 50% follow, just like hand hygiene 50 times and mask, probably we can reduce infection significantly. That's my thing. Thank you very much.
Thank you so much, sir. It's a very important information, and I think even I made a lot of important notes today. But I can see there is a lot of query in the chat section. So if you can help us with the answer the queries.
So first question is Meftal NOR recommended for fever? So yes. So we sometimes use Meftal in a guarded situation in the hospitalized. You just type in your Google Meftal Times of India December 23rd December 2023. You will get it. It is the drug, and lot of times what happens is Meftal reduces the seizure threshold. A lot of kids have a febrile seizure. So the chances of, if you give Meftal, there are chances of seizures increases. Second thing, Meftal is very bad to the tummy. I have seen kids coming to me with the bleeding from the stomach just because of one dose of a Meftal. I have seen kids coming to me with the bleeding into your urine because of one dose of Meftal. So, and if you go outside anywhere, Europe, North America, you will not see Meftal drug. If you search any preparation or trials, medical trials about Meftal, it is not there. So definitely, as per me, no Meftal in the kids. If you are in a very desperate situation And in a supervised situation, you can use it. Otherwise, no. Only two medication. One is paracetamol, first choice. But if after 1 hour of paracetamol, temperatures are not coming down, it's increasing. That means paracetamol is not working. You can use appropriate doses of ibugesic, or the paracetamol can be used every 4 hourly. So let it be you give a paracetamol at 10 o'clock, fever comes down. Again at 1 o'clock, there is a temperature within 4 hours. You cannot use paracetamol again. Then you can use ibugesic, no meftal from my side.
Sir, as you said, desperate situation for Meftol. What is the desperate situation here?
Desperate situation means you used Calpol or paracetamol, you use ibugesic, still fever is high. Or so in sometimes in the ICU or hospital, we admit the child because they are hydrated and they keep on having fever for 4 or 5 days and there is no response to the paracetamol and ibugesic. Then occasionally we use Meftal as and when required. And in a supervised situation, that means there is some guy who can follow them up. Then only we use it.
Sir, if hydration is fine and there are no other symptoms except the fever was high, like it happened with my son last month. So the fever was 105.5, but rest of everything was fine. But the fever was constantly that high and it won't come down with the Dolo 650 continuous dose, like every 4 hours. So the doctor advised Meftal 3 times a day and then I had to go ahead with it.
So now we have not used the second line, which is ibugesic, ibuprofen. So I would use ibuprofen there, and if the ibuprofen is not helping, then only I'll go to the Meftal. Second thing is, if the fever is persistently high, which is like out of the blue, 105 is a very high temperature, then so remember, hydration is also one of the treatment of fever. Normally, we should have, so if you are 10 kilo, child is 10 kilo, they should have at least a 1 liter of liquids in a day. If you have a fever, the same child had a fever, it should be 1.2 liters or probably 1.3 liters. And there are a lot of questions related to cold sponging also. Shall we do a cold sponging? So remember, if you can do a good cold sponging means you every time taking a new water and doing a sponging, that is fine. But it becomes very uncomfortable that you actually make it sure that the cloth is completely taken care of or clean and then put it into the clean water. I strongly recommend in this kind of a situation, you can give a lukewarm water bath, nice bath, lukewarm water, give a medication, clean them up, put a clothes and let them sleep.
Okay, sir.
One cold start, it takes more than a week to subside and then follows with cough. So only steaming, gargling with warm water, honey water is enough. It is not followed by fever. So as I told you, I don't believe in these cough and cold preparations, and you can do your own exercise also. If cough and cold is not compromising lifestyle, I would not use any medications, but I'll keep on doing non-medicinal things, which you are actually doing honey, cleaning the nose 2 times brush, little bit of propped up position. If the kid is little bit bigger, you can train them to blow their nose so that they can taking care of all those secretions out of the nose. Frequent nasoclear. Saline drops can be used every 30, 60 minutes also to clean the nose. So unless and otherwise I'm hitting on the wall or there is a strong history of allergies or asthma, food allergies in the family, then I might consider some anti-allergic medication, but not if cough and cold is not compromising lifestyle, I would not give any medications. How often flu?
Yes, sir.
Yes, please.
Again, sir, this Montelukast LC is also given by doctors in the first prescription without asking allergy history or anything. The moment there is fever, doctors will give paracetamol, and Montelukast LC is always there in the prescription. 3 times, like every night, 7 p.m. The timing is also there.
So now I cannot comment about other, but yes, this Montelukast medication was devised as an adjunct medication for asthma. So let it be, we have a asthma child who's on some puff and still plus minus symptoms are there, we give Montelukast. So I would say yes, it is definitely an abused medication, but again, it is at the cost of both, because now let it be, I have seen a lot of parents who want rapid relief. You go back 20 years when we were small, our nose used to be like that for a week or 10 days, and we used to be fine. Probably we got exposed to a lot of viruses and we are good. That doesn't mean that your child should have a bad viral infections. So there is some pressure from our side also that child should not have little bit of nasal secretions also, should not cough, should not do this and that. So that pressure is also sometimes get reflected and writing down the medication. But I don't personally use Monter L-Cigid. I don't remember also when last time I used in a cough and cold. I would say fever medication, as I told, cough and cold is not compromising. No cough and cold preparations. I am not absolutely against cough and cold preparation. I do use sometimes, But in a guarded, every prescription I write down, if it is compromising sleep and feeding, you can try. If it is helping, you can continue, otherwise stop. What happens a lot of times, the kids have a runny nose. You use cough and cold preparation, their side effect is the secretions become thick and blocks your nose, and it becomes worse. Flu vaccine, it is a seasonal vaccine. Every yearly has to be done. Till 15 years of age we can give. But what I would suggest you ask your pediatrician, how was the flu season last year? How many flus? How bad the flus were? And if they are really bad, kindly take the vaccine. And let me tell you, you all have probably elders in the house. I would strongly recommend, there is a very strong notion about adult vaccination because they form a significant, I would say, source of infection. Because, there are high chances of having a flu vaccine in their nose as compared to you. They can be a kind of a source of infection also, or they have a comorbidities. They can become more sicker than your child, or your child have a flu and it can goes to your grandparents or parents, which are having some diabetes, hypertension. They can have a higher chances of having problem than your kid or you. So I would strongly recommend, have or read about something about adult vaccination, kindly get that vaccination. There is a good notion about helping this adult also. Yes, if there is a flu, so as a doctor, I am a high risk. I do take a flu vaccination. And when I was in North America, it was very clear, either flu vaccination or use mask. So yes, depending upon this current scenario, I would recommend flu vaccination for 10 years old. Flu vaccination particular month. So usually we see a new, there is a lot of discussion. You might have had North Hemisphere, South Hemisphere, and all those things. But this is a good time to take a flu vaccination, July, August, September. Do we need to take in? Yes, it is a proven bacterial infection. That means your CRP, procalcitonin is high, or there is a pus point in the throat, or we have done the throat swab, which suggests you have bacteria, or there is a pneumonia, or we have done investigation which suggests you have bacterial. Then yes, we will give antibiotics. But as I told you, in general, if I have 100 kids coming to me, 80 will not require any antibiotics. So constant sore throat. So there are a lot of either, if there is no fever, there is no roadness of the throat, that means probably there are other things. The cleansing or the cleaning or local hygiene is not good, or probably before sleep you are consuming little bit of a sugar which is causing trouble into the throat. In that scenario, what I would suggest is make a habit of 2 times brush, warm saline gargles at the night. Make it sure after that you don't offer them any sweet things. So this will take care of that. Make a part and parcel of the life so that they don't catch the infection again and again. So Puneet has asked this question. Yes, if after 2 days fever is persisting and doctor feels that there is a probability of bacterial infection, you can yourself ask, sir, I'm okay to consider some investigation to decide whether it is a bacterial or viral. And by doing a simple investigation, we can identify it is a viral or bacterial. And if it is a viral, we'll wait and watch. If it is a bacterial, you can consider antibiotics. You can initiate that discussion or dialogue with your pediatrician. Relent and scenarios are okay to take care for cold. Probably I'm against them, so I cannot say. But if you are in a desperate situation, you can try. Okay, good. Giving curd, orange, lemons, any food recommendation. So I am this disclaimer is I'm a very liberal doctor, and I do try all those things in my kids. So I also, so there is a good literature that vitamin C decreases the chances of recurrent respiratory tract infections, and lemons are a very good source of vitamin C. I don't feel so. Curd, coconut water, banana, lemons increase the chances of fever and cough and cold. Otherwise, you can imagine these are such a nutritious food. We're actually kind of making the kids not having this food during this time is really a bad. And second thing is, we keep on targeting about this orange lemons. Don't give it. The child had a cough because of you gave lemon, because you gave coconut water. But we don't concentrate. Did he had a steam inhalation? Did he brush 2 times? Is he actually keeping his mouth clean? Is he cleaning the nose? We forget about that, but we keep on blaming this curd, orange, lemons, and all those things. So if you take my word, I'm okay with food, any good food, homemade food, clean food. Can Ascoril kit be given in the case of bad cough? Again, I'm telling you, cough and cold preparations are useless. If it is not compromising lifestyle, I would wait. Sometimes you can try. They are over-the-counter prescription. If it is helping in a day, you can continue. Otherwise, you stop. Ibugesic doses, so basically it is 10 milligrams per kilo for 5, it is depending upon the weight. So 6 years, if it is 20 kg, it is around 6 ml. Are syrup effective for 10-year-old, or there is nothing like a syrup and tablet? If the same dose, let it be, I wanted to give 500 milligrams of a medication to one of the child and he is not comfortable with tablets, so I will give syrup 10 ml, which is Crocin DS, which consists 5 ml of 240. But the same child saying, no, I'm comfortable with the tablets, I can swallow the tablets, give them 500 milligram of tablets. So there is nothing like a tablet and syrup. Whatever appropriate dose, we can give it. So let it be a child doses 250 milligrams and he don't wanted to take syrup. So Crocin tablet, you can make it into half and you can give a half tablet. So if there is a severe cough, I would love, I would like to see them clinically. Is there any wheezing or any other symptoms before prescribing any medications? I cannot actually comment on this platform. Again, you asked about effective cough syrup. Effective cough syrup, unless and otherwise see them, I would not. And if I wanted to use something, I would use with the dextromethorphan. That I can tell you, but there are different combinations available with different doses strength. So I would not comment dose also here. If the fever not reducing in 4 hours with paracetamol, can we give? No. If the fever is not reducing in 1 hour, after giving paracetamol, you can give ibugesic, or fever comes back within 4 hours. So that you cannot give paracetamol within 4 hours because minimum duration is 4 hours. Yeah, we have actually recorded this. So probably we might share with the hospital, school.
Doctor, there's one question. What is happening of late is that kids are getting fever very frequently. So even if they recover, it's like almost after a month, after 45 days, it keeps happening. Is there a way for us to kind of build the overall immunity? I saw you talking about not taking Monter LC because there are pediatricians who are recommending that to give it for a month or like 45 days. Is there a general way, for example, like maybe something like a Chyawanprash that can be administered? I don't know how to improve overall immunity these days.
Great questions, and you're gonna have a great answer on this. Look, so I have a lot of insight about this food and all those things. I personally feel whatever eating, sorry, I'm using that word. What we are eating is probably not nutritious. Let me be honest with you. The reason is not that we are not buying it from the good center or organic food. There is nothing in the soil.
Correct.
You can get it from the things. So that's why I don't promote, but I feel so. So let it be. Any child is iron deficient. So I can ask you to eat 2 apples or 3 apples per day. Tell me at this moment, even an 11-year or probably adult also cannot eat 3 apples per day.
Correct.
Now, just imagine 3 apples per day. So we are all belongs to a good socioeconomic status, but let it be a medium family. 3 apples, 150 rupees per day.
Correct.
It's a huge financial burden, and I don't know how much iron is there in that apple, from where it is coming.
Correct.
So what I would suggest is, look, there is a way of building immunity. Look, immunity doesn't mean that kind of an immunity. These are all their memory. They have to go through these viral infections to develop that kind of a memory, viral memory, but just to understand and help their body. So what we need a good proteins. So make it sure that your food is having a good protein, which is absolutely a neglected issue.
Right.
So good protein. There is a very good protein in veg and non-veg. So good protein. So almost 2 to 3 grams per kilo. Second thing is lot of hydration.
Right.
Third thing is you can think about including 1 fruit a day. And again, I am not promoting any medications here, but I strongly recommend we should give intermittent multivitamin syrups or multivitamin gummies, whatever you wanted to buy, whichever brand. So every alternate day or 2-3 times in a week, you can keep on. Because why? Our diet is incomplete. So what will happen is this will have a concentrated amount of multivitamin or anything which will be helpful. You know how many Hyderabadis are vitamin A deficient? 60% Hyderabadis are vitamin A deficient. 70% are thiamine deficient. Almost everyone here, all parents, if you do their B12 and vitamin D, you are deficient. Though you are eating nice, why? I have a parents where I gave vitamin D 2-3 times, complete doses, still they are deficient. So it is not just about the food. We are also changing. Our intestines are also changing. We are not absorbing. I had the best diet. I eat a lot of non-veg. I have a best workout regimen. Still, I was B12 deficient. I don't know from where it came. So what I wanted to say is intermittently giving some multivitamin, giving some iron supplementation would actually take care of your small nutrient deficiencies. And high amount of proteins, fibers, this is two very important things, and probably a food per day.
Right.
Again, one thing I want to tell you, I got a 3-4 messages since morning about dragon fruit.
Hmm.
I never heard of this fruit when I was small. And probably last 6 months back also, I didn't heard of this fruit. Whenever you used to go to exotic, probably banquets, there you used to see. Now everywhere it is available in 10 rupees also you get it. Lot of this fruit after eating, kids are coming with urine color, red urine color. So I suspect they are putting colors into this dragon fruit. Be aware from where you are buying it. I got a 3 messages since morning that after eating a dragon fruit, they had a urine which is reddish in color, pinkish in color. So probably they are putting a coloring agent in this. Okay.
Thank you, Doctor. This clarifies. Just one request. I mean, there were recommendations on Zincovit as the multivitamin. Would you recommend that, or any other things?
So Zincovit is there. Any brand you can buy. Zincovit, A to Z, Bivon.
Okay.
All three are good. And if you want the gummies, there are which this I think so Pfizer or Johnson and Johnson came with Centrum, which is
Okay.
available. Centrum Kids gummies.
Right.
And iron, I would also. We are all iron deficient. There is no iron by 2035. There will be no iron in our soil. So
Okay.
imagine what we are going through, where we are going through. So the amount of iron which one apple used to have 20 years back, now you have to eat 20 apples to get the same iron.
Oh
So
God.
we are going in a catastrophic position. So what I wanted to say is keep on giving some iron intermittently in between.
Okay. Sure.
Vitamin D shots are not there unless and otherwise they are deficient. Then only you can give shots. Zincovit doses 5 ml to 10 ml you can give. Even if you give a little bit of excess, they will pass it out through the urine. Okay, so how many days you have to see the recommendations written on the bottle? How many days you can use it? Nitya has some question.
You can unmute and ask your question. We can, yeah.
Some people will say after opening the bottle, we should use only for 15 days like that. That's why I'm asking how many days we can use
No,
it.
very clearly, ma'am. You have a small kind of a label inside that box. You will see storage and recommendations.
Okay.
So you can so there are some like eye drops they have to throw after 5 days. So it will be written. It is a manufacturer kind of a recommendations.
Okay, sir. Thank you.
So also there is this question in the chat box also, and my question is also the same. So the kids these days, they get high fever, like as high as 105, 105.5, but otherwise the kid is normal. Eats okay, sleeps okay, everything is fine. But the fever in the thermometer is always so high. So
Nothing. The temperature amplitude, nothing to do with the sickness level, unless and otherwise it's a bacterial infection. Unless and otherwise you are getting admitted and you're not responding to the treatment. If they're hydrating well, they are good. Probably it is just bad luck that the temperature is very high.
So in that case, should we get the child admitted, or we can take care of him at home?
So as I told you, if the fever is persisting more than 2 days, so let it be fever is just 2 hours, and child is really looking uncomfortable. He is very apathetic. He's not moving. He's not eating. That means you have to admit.
Okay.
But let it be child is having fever for 2 days, but he's active in between the fever. He's playing and all those things. In that scenario, after 48 hours, if it is a high fever, you speak with your doctor, get some investigation done, identify it's a viral or bacterial. If it is a viral, keep on continuing paracetamol, hydration, wait and watch. Indication of admission is not fever. Indication of admission is hydration, work of breathing. They are having fits. They are looking lethargic. They are not passing urine, loose motions. Fever is not exactly only the reason. Unless and otherwise, there are certain conditions we call it as a pyrexia of unknown origin. They kept on having fever more than 7 days. Then we admit for evaluation. What exactly the reason rather than just for other small things.
Okay, sir.
I don't know whether you should stop it, but I don't give it.
Also, sir, can you tell anything about this HPV vaccine? So pediatricians are recommending this HPV vaccine, but there are very mixed reviews about this. That
Very
it should.
good question. Very good question. you should give HPV vaccine to all the girls and boys more than 10 years of age. Remember, all the girls and boys. I have given it to my boy. Absolutely recommended less than 15 years, 2 doses, 6 months apart. More than 15 years, 3 doses. And now there is a very good recommendations to give HPV vaccine for all the females less than 45 years of age. Initially, what they used to say, the kids who had like after childbearing age, we don't give it, but now there is a good, it will reduce the chances of HPV virus. So, and absolutely recommended, boys and girls, both.
No, adults also less than 45 years of age, as you
Yes, now
said.
currently their recommendation coming 3 doses. Initially, we never used to give who had for like, I would say after childbearing age, we never used to give, but now there is a recommendations we can give 3 doses because what they say, ki though it will not protect that much, but it will have a good amount of protection, 30 to 40%, which is itself is a very good because it is going to prevent your cervical cancer. And 70% of penile cancer are also penile cancer means boys cancers are also HPV related.
Okay, sir.
Good.
Sir, thank you so much, sir.
Good.
I think all questions are answered by Sir. So I just wanted to say thank you so much, Dr. Parag, for the very informative session. And thank you so much for all the parents to joining us today. And yes, if any further questions, I think we will reach out again to Sir to helping us for all the queries. So we can take a leave for today.
Yes, please.
Thank you so much, sir.
Thanks. Thanks, ma'am. We will share that recorded link. Sharif will share with you. Okay, ma'am?
Sure, sir. Sure, sir. Thank you. Namaste.
Namaste.